Hello everyone, I am Dr. Shikha Garg. Today we are going to discuss pink eye or conjunctivitis. So as it is now very much prominent in our area, so we are going to discuss what are the causes, what are the signs, symptoms, how to prevent it, what is the treatment and how to go about it. So first of all, the conjunctivitis or conjunctiva, it is a layer on the white area of the eye. So when it gets inflamed or there is inflammation or affected by the viruses, bacteria or allergic or fungal things, it can get inflamed and it can cause the redness of the eye, which is called the pink eye. So the latest one which is caused is because of the virus, which is the adenovirus. It is highly contagious, and that is the reason everybody is getting it from one person to another. It can cause through can be spreading through droplets, through touch, through airborne things. And so you have to be really important to take all the precautions, necessary precautions. So if anybody is having that conjunctivitis, the main important thing is to isolate yourself. Do not touch the things and do not touch your eyes frequently. Frequent hand washing is very important, and get the treatment from the ophthalmologist or the doctor, that is the eye surgeons, as soon as you diagnose it. And usually the diagnosis itself, when you get irritation, redness in the eyes, or itchiness in the eyes, watering of the eyes, along with you can have fever, you can or cannot have fever, probably you can also have sore throat. So all these symptoms, they are the self-diagnosing kind of thing. But for the particular diagnosis and to get it treated quickly, you need to visit your doctor. Although viral diseases are self-limiting, so you can it can get cured itself also in 2 to 7 days, but usually because of the other symptoms which are creating a problem, so you need to get the symptomatic treatment. So you need to visit your doctor. So apart from the symptoms, what are the other causes from the apart from the viral disease? Other could be bacterial, could be fungal, or could be allergic. To rule out all those things, it would be the case would be like for the viral things, it would be very acute, severe. In cases of bacterial infection, it could be long lasting kind of thing. It will take few days to develop. For the allergic thing, there would be particular allergens, particular stimulants which will cause problems. There are people like who get affected with sunlight. So when you ever pass through harsh sun, harsh temperature, or humid weather, then they can get allergic kind of itchiness in their eyes. That is an allergic one. So in the upcoming PPT, we are going to discuss all the types of conjunctivitis, what are the treatment options, what are the signs, symptoms. The most important part is the precautions or the prevention. And at the end of the PPT, you will get all the links to the PPT or the video to one of the pink eye by a expert ophthalmologist, and also a link and contact addresses of all the doctors available. So kindly watch through all of the video. Thank you. So we are discussing pink eye or conjunctivitis. So this is an overview. So it's an inflammation of the transparent membrane that lines the eyelid and the eyeball, that is called the conjunctiva. So when the small blood vessels in the conjunctiva, they become swollen and irritated, so they are more visible, which can cause the redness, which can appear to look pinkish. So it's also called pink eye or red eye, and is basically conjunctivitis. So used most commonly caused by the viral infection, but can be caused by bacterial or allergic reactions. And in newborns, there could be incomplete open tear duct, which can cause that inflammation and can cause conjunctivitis. So it can be very irritating, and it does not affect your vision permanently, but because of the irritation, there might be slightly kind of blurred vision can be there. So treatment are all these helps in the ease of the discomfort of the pink eye. So that is a symptomatic treatment. Otherwise viral diseases, they are self-limiting, so it will be cured by itself after like 7 to 10 days. So pink eye is very contagious, so early diagnosis and taking certain precautions can help in its spread and also limiting the symptoms. So symptoms are the redness in one or both eyes, itchiness, a gritty feeling, that is something is there in the eye. So there could be a discharge in form of the crust, there could be tearing, and there could be sensitivity to light called the photophobia. So when to see a doctor? It's a serious, can cause eye redness. It may cause eye pain. So you need to see the doctor. There could be blurring of the vision, light sensitivity, and if any of the symptom is present, you should seek an urgent help. Those who wearing contact lenses should stop wearing them. And if your symptoms don't start to get better after 24 hours, make an appointment with the eye doctors, because then it may can go into the superadded bacterial infection as well, although rarely, but superadded bacterial infections can happen. So main common causes are the viruses like the adenovirus, which is the latest one and which is very common and contagious. Other could be bacteria, allergies, any chemical splash in the eye, foreign object in the eye, or in the newborns there could be a blocked tear duct. All these are the causes of the conjunctivitis. So viral and bacterial conjunctivitis, most of the common cases of the virus is by the adenovirus, and what can be caused by other viruses like herpes simplex and varicella zoster. These can occur along with other symptoms like cold or symptoms with the respiratory infection, sore throat. And if you're wearing contact lenses that are not clean, it can cause also, that can also be a cause of the bacterial conjunctivitis. So these both are very contagious and they can spread from one person to another. So you need to isolate yourself and to get the treatment. So for the allergic conjunctivitis, there are links to the few videos where you can see what are the allergic things, how to get the allergic panel done, what are the tests available for the allergic thing to rule out. So you can rule out what there could be a allergen. So to check for all this, kindly click the link below. So allergic conjunctivitis usually affect both eyes, and it is response to the allergic causing substance. Could be a pollen, could be weather condition, harsh sunlight, etc. So to rule out which allergen is causing that, you need to visit this link in the description, this in the slide. So basically there is a release of IgE which can cause the release of histamine. So there would be itchiness, there could be symptoms like pink eye, but it will be always be with the exposure to certain things, certain particular things. It will not be a seasonal thing. So if you have allergic, there could be itching, tearing, inflammation. So it is basically treated by symptomatic treatment is done with the drops, but the real thing is to get the know the allergen which is causing it, so that you can avoid it. And allergic conjunctivitis are non-contagious; they do not spread from anybody to anybody. So conjunctivitis resulting from the irritation, that is with the chemical splash or anything in the eye. So for that we need immediate flushing and cleaning of the eye to wash the chemical, and symptoms can be watery eye, mucus discharge, and if flushing does not resolve, or there could be a damage in the tear membrane or the conjunctival membrane, you need to see your eye doctor so that that person can check your conjunctiva. There could be a tear or there could be any other damage. So for this you do not have to go in for any symptomatic over-the-counter drugs. You really have to visit urgently and immediately to the specialist doctor. So risk factors for could be when they are the viral or bacterial, usually from one person to another. For the exposure thing is for the allergic, when you are exposed to certain allergens, and contact lenses. So complications is usually eye pain, a feeling that is something is stuck in the eye, blurred vision and light sensitivity. So how to prevent? This is a very important part. So you have to maintain good hygiene. So do not touch your eyes. Wash your hands often. Use a clean towel and washcloth daily. Don't share your towel or any clothes. Change your pillowcases often. Throw away all the eye cosmetics, and don't share your cosmetics or any personal eye care items. So how to prevent pink eye in the newborn? They are susceptible to bacteria present in the mother's birth canal. So in cases of normal vaginal delivery, there are more chances of getting a pink eye in the newborn. So these are the bacteria, they do not cause symptoms in the mother. So in infants, there could be conjunctivitis, we call it as ophthalmia neonatorum, which needs to be treated immediately. Nowadays, whenever a child is born, shortly after birth, there is an antibiotic ointment which is applied to the newborn eye in every hospital. So usually it prevents the infection. For further queries and further details by an expert eye surgeon, this is a link to the video, and if you want to contact the eye surgeon, feel free to call the number below. Thank you.